Welcome to Deep Unwinding Myofascial Flow. Myofascial flow is a combination practice of primal movements, acupressure and meridian stretching, and longer held yin style stretches that encourage spontaneous movement. And the goal of all of this is to release deep tension, especially along the spine and in the core of the body, so that we can feel freer as we move in our bodies, have less pain, and just feel good. So let's get started. I'm going to start with primal movements, and I break down primal movements in some other videos. So we're just going to jump right in and do a couple minutes to warm up. Primal movements are similar to exercises you might do in Kundalini Yoga or Qigong. I'm starting out with shaking, which is a back and forth motion that you can do seated, standing, or even laying down. And what this does is help to release the tiny muscles that run along the sides of the spine, in between the vertebrae, as well as to activate our organs along the sides, so we're waking up the nerves, as well as the sides of the body. And the sides of the body are very important because they are our wood element, our liver on the inside and our gallbladder channels on the outside. And when you think of wood and trees, we think of things that are flexible and can bend in the breeze or the wind without breaking. And that's exactly what we want for our body. We want a balance of flexibility and strength. And this movement and primal movements will really help to release tension so that our spine can bend without breaking or without pain. So it's just a side-to-side motion, kind of like flossing. You feel like you have a string either pulling, focusing on your hips or your chest. And after a while, you want to see if you can relax into it. When we're holding ourselves really strong and upright, it's good for building strength, but it's not so good for encouraging release of tension. So we want to use as minimal muscles as possible. What does it take? What is the minimal amount of strength or tension it takes to hold your spine up? And we want to try and encourage that in this moment. All right, let's do a little bit of rocking. So rocking is a back and forth motion. And it can be, these can be at different rates or speeds depending on what your body needs. A little slower rock will be similar to being rocked in your mother's arms or rocked in a rocking chair, and it will be very soothing. A little faster will be more of a sensual or a sexual kind of speed, and that will really encourage our organs and our nervous system to wake up. Especially in the front of our pelvis, we have our a front G-spot, and in the back of our pelvis, we have a back G-spot. We're also encouraging a reset through our sacrum, where a lot of our sensual and sexual nerves pass through. You might want to take a deep breath or notice yourself needing to sigh. That's a good sign that tension is being released, so pay attention to that and encourage more deep breaths, more sighing if it feels good. Okay. And pay attention to your body. Sometimes it will want to shake more, sometimes it will want to rock more, sometimes it will alternate back and forth. And the next thing we'll do for primal movements is bouncing. And if you're seated, you can come to kneeling. It's a little difficult to do cross-legged, but standing is fine as well, or you can even do it laying down. And I will break down standing and laying primal movements in other videos. For now, we're just going to focus on a seated position. And we're just lifting our hips off of our heels slightly. I'm not even going all the way off. I'm just lifting up a little bit. And this activates the top and bottom, the roof and floor of all of our various systems. So our organs are getting massaged. Our diaphragms, we have a number of diaphragms in our body. Diaphragms are muscle tissue that run horizontally. And often tension will build up, and we don't really have a lot of ways to release them in our daily lives. But bouncing is great because it will help to release tension in those horizontal muscles, as well as activating our organs. So with all of the primal movements, we are massaging our organs, something that doesn't happen very often. Obviously, they're internal. We can go see someone that does visceral manipulation or Vigo abdominal massage, or we can learn to do it on ourselves. But throughout the day, adding in these primal movements will keep your organs stimulated, keep the tension as low as possible. And you can do it for just a minute or two, whatever feels good, throughout the day as you notice tension starting to build. So what we want to think about as we're moving into our bodies right now is, do I have pain and tension anywhere in my body? How does my body feel right now? Can I sense all the way through my body? Are there areas where it's blocked, or maybe my awareness isn't very good, or maybe it's even numb or painful? And so just notice those, send your awareness through, and notice any sensations that come up. And just mark them on a little list on the side in your brain as something to focus on further in your practice. We're just starting out. This is more of a self-awareness class, and I will create more classes with specific routines for different issues like neck pain, back pain, foot pain, and such. All right, so we're warmed up. We did some primal movements. We got some good release. As we're going, I want you to think about both engaging your abdominal girdle, so we have muscles that go all the way around here. So engaging it as well as releasing it. And this is a big theme throughout all of what I teach, is the idea of contraction and release, or engagement and release. And how do we accomplish this? So one way that we can work on that is by following our breath and drawing in and releasing out, or drawing up and releasing down. And if we can work with all of those different directions, then we will have engaged and relaxed a variety of muscles with simple movements, and release deep tension on a number of planes and levels with joy and with ease. And that's the goal of everything I teach, is to learn how to feel good in your body with simple movements that work on a number of levels. We're stacking functions. We are making the most of our time because we got stuff to do, we got things to do, and when it's playful and effective, we're way more likely to do it. All right, so I think the next thing that I would like to do is move into some stretching. And in deep unwinding, we focus our stretching on our meridians. And if you've read any of my work, you've probably read about meridians, pathways, or circuits. They're the same name for the same, or different names for the same thing. But they're basically pathways of nerves, blood vessels, muscles, connective tissue, basically how things travel through our body. And they follow consistent patterns that developed when we were an embryo, when we were just starting to develop. And for thousands of years, Chinese medicine practitioners have known that we can access our internal organs through these meridians. When we work with stretching them, then we can affect a whole chain of muscles. And so it has a really strong effect, just doing a little bit of work with our meridians. One of the main meridians that I like to focus on, especially for women at this time, is our gallbladder meridian. And so we talked a little bit about the wood element as we were shaking back and forth, how it's the side of the body, and it helps us to be flexible and strong. The gallbladder meridian is especially important because our physical gallbladder organ often will get backed up, with stress, with not eating well, with kind of long-term chronic issues. Our ability to make and disperse, to actually use our bile, which helps to break down fats can really be affected. And that can show up all along the meridian, which runs from the fourth toe, the very tip of it by the nail, goes all the way up the side of our calf and our thigh. It's kind of moves around in our hips, so it moves inward, and then it goes up through our low back, up our shoulder, into our neck, and all around our head. So if we have any issues along that channel, that pathway, whether it's just tension, ankle weakness, knee pain and weakness, hip issues, that pain in the butt, especially if it's on one side, any back issues, shoulder pain, headaches, all of that, we can work with the gallbladder meridian. And one of my favorite ways to work with it is with a side lying or supported side lying pose. And so what I recommend is making a nice pile of pillows, excuse me, and I am just on a mattress right now. I like to do my deep unwinding on a mattress against the wall, ideally in a corner, because then we have support for traction, and we have a nice soft space where we can really settle deeply into our stretches. So I am making a pile of pillows, and you can adjust the height to whatever feels good to you. Typically 2 or 3 pillows, depending on how puffy they are, is a good amount. You can also use blankets. You can use a foam roller, but I do recommend wrapping it in a soft blanket so that you can stay on it for a longer period of time. This is a little bit different than typical foam rolling exercises, so we won't be using it in its the normal way, but that's an option as well. You can also do this pose on an exercise ball, one of the big inflatable ones, as long as you have something to stabilize, so against a wall. And I would only recommend that if you tend to have good balance and you are pretty good in your strength and flexibility already and are just wanting to take it a little further. So we have our pile, and this is great to do before bed, by the way, because if you're already in bed, you just have your pillows. After you're done with the exercise, you can just push the pillow aside, roll over, and go to sleep. This pose is very calming. It moves a lot of energy through the body, so it can actually even make you a little tired at first. But then once you've done it a few times, it tends to be calming but energizing. So it's great to do before you need a lot of energy, if you need to be at your best. And let's get to it. So I'm tucking the edge here under my right hip, and it doesn't matter what side you start on. It's good to do both sides. If you do tend to have one side that holds more tension, you can focus more on that side, but we want to keep balance as much as possible, and that's something that you'll just have to explore. What does balance mean for you? If I tend to have right-sided pain, I might stay twice as long in the pose, or I might occasionally skip the left side if I'm pressed for time, things like that. So we're tucking it in under our hip and draping our side over so that we are coming off of the top. And if you tend to have neck weakness, you can also have a pillow under your neck for support. If not, I recommend just letting it hang down so you can get an optimal stretch through the shoulders. But again, if you have pain or a lot of tension, just start slow. There's no need to push it. And you can even decrease the height if it's too much of a stretch on your side. Just focus on what your body needs and progress slowly so that you can keep progressing instead of causing a recoil or a respasm and having to take a break or start all over again. So we're draped over, opening up the side body, the wood channel on the outside, the gallbladder meridian. Now this is great just to start, just opening up the side, but we can take it deeper and work with as much of the meridian as we can. Our meridians really like to be used fully as much as possible. So right now we're just kind of stretching a piece of it. But if we add our leg in, so stretching the leg out, my foot, my toes are flexed towards my head. Here, I'll move up so you can see. And I'm pushing down through my heel. And that is activating into my hip, causing some traction. So my hip bone, my femur, the head of my femur, is gently pulling down out of my hip socket. As we age, we tend to get a lot of compaction, a lot of compression through our hip joint. And the more we can release that, the better our hips will age, the less likely we will be to need hip replacements or to have major hip issues. So I'm just pushing down through my foot. You can think of it as like a laser beam pushing out of your foot, or whatever you need to help you find that sensation. So I'm feeling it all the way up into my low back, through my hip. I'm feeling a pull down through the side of my leg, also a little bit through the front of my leg, which is the stomach meridian, which is great to open as well. And we can add in our arm. So arm up overhead. This will get an opening in the ribs. And again, we can extend through our fingertips, laser beams shooting out, so that we're getting a lengthening of the muscles. When we lengthen while engaging our muscles, it tends to make it easier to lengthen the connective tissue that surrounds our muscle. And so often with stretching and yoga poses, we hold them for short periods of time, which stretches the muscles, muscle fibers. But then if the connective tissue surrounding the muscle isn't lengthened as well, the muscles will tend to go right back into a shortened position. So when we do these longer holds, we're really focusing on the connective tissue around the muscle that runs all along the meridian. So we're getting the meridian from the fourth toe all the way up the side of the body to the ribs right now. Remembering to breathe. We're gently drawing in the girdle muscles around our belly and low back just for stability. And then as we exhale, we can release them and sink a little deeper. We can also shift into different positions to affect the gallbladder meridian differently. One thing we can do is bring our leg forward, and this gets a little more of the hip. We can also extend our arm backwards for a supported twist. This will help open up the lung meridian, the heart, depending on how we position our hand. So if our palm is up, we're getting more of the lung meridian. If our palm is down, we're getting, and we can press through the palm as well, we're getting a little more of the heart meridian. All the meridians are connected in different ways, some stronger than others. When we have a lot of congestion through our gallbladder meridian, it might make it to where we're not able to take as deep of a breath, and so that would affect our lung and heart organs and meridians. Remembering to breathe in, engage the abdominal and low back girdle, and then exhale and release. You can explore moving your arm in a circle and seeing where you feel the strongest pull. I feel it right here, so my arm is extending back behind my head, extending out through my fingertips and feeling a nice strong pull in my armpit. And so that lets me know that that's an area that I can focus on to release tension. And just holding for as long as you can. In total, we want to hold this pose for at least 2 minutes. 2 minutes is when we start to get the connective tissue lengthening. Longer than that, though, of course, is optimal because we keep getting lengthening. How long to hold it depends on your body's needs and what it can handle. If you start feeling like you're ready to come out, just roll to one side slowly, take a deep breath, and then push up. We can also twist with the leg back. And I'm just bringing my front leg out to support, and then roll forward with the shoulder. So this is a little bit different twist. It's getting a little bit more of the low back, whereas before with this twist we might have been opening the stomach meridian a little bit as well. With this one, we're moving into more of the low back, maybe the kidneys and urinary bladder channel that run along the spine and in the back of our core versus the front. So again, we can extend through the fingertips, exploring different ranges with our arm to see where we feel the most pull. I feel a nice one right here. So I'm just breathing, sighing, releasing as I lengthen and extend all the way into my armpit, into my chest, feeling a nice strong pull. Good. Should feel really good. This should not be painful at all. If it does ever feel painful, just back off a little bit. And if it ever feels overwhelming, like your body wants to go back into a spasm, make it less intense. You can start out really small and slow. And this works great even for, I would say, subacute injuries. So if you, strained your low back or tweaked your knee or whatever it is, once, I would say, the first few days or week is gone, you can start moving back into these exercises again. If you do injure your back or another part of your body, the first thing I would do is go to positional release exercises, which is a shortening of the muscle so that deep tension and spasm can release. And so what we've been doing for the right side of the body is basically positional release. It's shortened. The ends are pulled together in a shortened and relaxed position so that it is has an easier time of releasing tension, and the nerves can start to function again because they are getting circulation versus compression. So now we can switch to the other side. So I tend to do the side that doesn't have as much pain first, so that the other side, the side that does have more pain, has a chance to be in that relaxed, released position before we stretch it. Anytime you have a lot of tension or spasm that's chronic, it can be really beneficial to move it into a positional release pose before we stretch. So I'm just switching my pillows. So tucking your hip, pillows under your hip, draping yourself over, making sure you have a good height, pillow under the neck if you need. Extend the leg, pressing through the foot, and you can explore different positions with the foot as well. So you can try having your toes turned up. That will get a little bit more of the stomach meridian again. The stomach meridian runs through the psoas, which is great to open the front of the hips. It also runs through the belly. And so if we have our toes turned up and our arm open, we're getting a nice strong stretch through the stomach meridian, supporting our digestion, supporting our ability to relax tension through the front of the body. You can have the toes turned down a little bit more and roll forward, and that will get more of the urinary bladder meridian and the kidney meridian, which have a lot to do with back health, spinal health, our ability to ground and to heal our nervous system. Or you can just have the toes pointed forward. So explore that as you're pressing through the foot. Explore how it feels to have your foot in different positions. And then inhaling, extend the arm overhead. I'm feeling like this side could even use a little bit more stretch, but I'm going to see what I can do to intensify it without adding any more height. So we're thinking about lengthening. A lot of times when we have one-sided pain, it will be due to the fact that we are crunching in all along the gallbladder meridian. So if you have one-sided low back pain, knee pain, often you will have, if you have one-sided pain, often it will be all the way from top to bottom. So really focusing on lengthening this entire meridian, this entire pathway, can be really beneficial. We can also add in massage and acupressure to help reset and stimulate the nervous system. And what that might look like is gently pinching along the side of the body. You can warm up by rubbing, getting the hip. You can use your knuckles and either rub back and forth on the hip or do little circles, or even get in there, stay in one spot, press down, and kind of grind gently. Again, we don't want to do anything to cause pain right now, because we're encouraging our nervous system to reset. We're encouraging our fascial line, our connective tissue, to lengthen, and we don't want to startle it and cause it to recoil. So we're being super gentle. But you can get in and give some gentle pinching. As we're pinching and feeling along, we can assess the quality of our muscle tissue and our connective tissue. So if there's a lot of tenderness as you're pressing, if you have a hard time pinching the skin up, then you know that there are adhesions. And adhesions is where the connective tissue is kind of clumped together. Sometimes to itself, sometimes to the muscles underneath. Internally, we can get connective tissue that has adhesions to our internal organs. That can be a big cause of things like endometriosis and other menstrual issues. So it's really good to assess the condition of our fascia or our connective tissue. And so working along the ribs, down the hip, into the thigh. A lot of times if we have a lot of cellulite, this area will be really painful. And that is because that connective tissue is stuck together. And it's compressing a lot of nerves, it's compressing a lot of fat, and that's what causes the dimpling. So it's not necessarily that you have maybe even a lot of fat, but that the connective tissue is just dysfunctional. And so we can get in there and start working on breaking it up by gently pinching and rubbing. And I'll have some other videos coming out soon that demonstrate how to deal with connective tissue dysfunction using various tools like cupping, bleeding, blasting, and a little more self-massage and acupressure. So if you do struggle with chronic pain, cellulite, anything like that, those can be really good videos to help you figure out how to work through those issues and move into a state of better health, as well as feeling good in your body and feeling like you are radiating the beauty that you feel within. So, focusing a couple minutes at least on each side, paying a little bit more attention to one side if you tend to have more one-sided pain, exploring different areas of pull, ranges of pull, possibly moving into twisting to get different aspects of the body, but really staying in as long as we can to get a nice lengthening through this meridian. It will help to improve digestion. It will improve our courage. The gallbladder meridian has a lot to do with courage. If it's congested, we are a lot less likely to take risks in our life, even calculated risks. We might just be too stuck in our worries and our fears to move forward. And on that note, if you do feel overwhelmed, afraid, not brave right now, and you're wanting to be able to shift into that space, a great way to access courage is with what I call the courage point. So that is on the gallbladder meridian, the outside ankle, and you're going to drop down and move forward just a little bit, and there will be a nice hole right in front of the ankle. And you can press that point with your fingers. You can just press down on it. You can rub it gently. You can move back and forth, especially if it's crunchy at all or you have ankle instability.